Hi everyone, this is Dr. Ashwini. Today I just wanted to make a video on what happens during a weight management consult. This is how I usually do my consults. Every doctor may have their own way of doing it, but I just wanted to give an outline of what happens. So usually the first appointment, I advise patients to make a long appointment because that's the very important part of the first appointment is history taking. So we'll get a full history on your lifestyle, your medications, family history, just understanding your sleep pattern, your eating habits, your exercise regime. So that will take a bulk of our consult. So once we identify what are the risk factors or what needs to be addressed, then we might order blood panels just to look at your metabolic health. This may encompass liver, kidney, cholesterol, sugar levels, thyroid, iron, hormone levels, uric acid. So this is more individualized based on your presenting, what's your symptoms and what you're presenting with and your own individual family history. And during that consult, we'll also do some measurements like your blood pressure, your waist, hip, we look at the ratio. So we might do those kind of measurements, understanding your BMI, understanding all of that. And then we would be planning, okay, what's our options? What are we looking at? So once we get the bloods, then we go into the second step. So this may encompass seeing a dietitian if you need, correction in your diet. There are a variety of diets out there and it can be quite confusing for patients. But what I tend to look as, we just support patients based on their own beliefs, their own family background, their own family food. So if you're vegan and you need to see a vegan dietitian, then we talk about that. If you're on low carb, if we tend to individualize your diet and see what's really needed to help you lose weight in your journey. So after that, and then the next step would be looking at your exercise and your diet. So whether we need to modify your lifestyles to achieve the weight loss. But for some patients, you might need pharmaceuticals. So currently there are a few available. There are injectables, daily and weekly injectables. There are oral medications that are used. So some can be used short term, some can be used long term. So we tend to then understand what's your risk factor and create a plan for you. So after this, once we start you on medication or lifestyle changes, then we tend to review initially 4 weekly. Some patients like to come in a bit more frequently. Some prefer, a bit longer duration. So initially 4 weekly, then we go to like 8 weeks, 12 weeks, then we might just review 6 monthly. So this is how basically I plan my weight management consults. I think it's really important to have this conversation with your doctor because weight management, I don't like to just focus on weight loss. I think it's just being healthy, being in your healthy weight prevents a lot of medical health conditions, like we know diabetes, cardiovascular disease, sleep apnea. And it also improves mental health, usually when people are in the optimum health conditions. So if this is something you're looking for, definitely book in with your doctor, speak to them openly. There's no shame in asking for help for weight loss because weight management is actually a very important thing for healthy lifestyle. So I hope this video gives a bit of breakdown on how a weight management consult may take place. And I hope you found it beneficial. So see you next time.